Hi, I'm Ginille, cosmetic nurse practitioner of 13 years. I practice cosmetic medicine in Los Angeles and Las Vegas. We've got 3 clinics, Jossie Skin and Wellness. You can find us in Mar Vista, Torrance, and then on the Summerlin side of Vegas. Please hop in and let me know questions you have. I'd like to do this time where we can just, whoa, I don't like that. Where we can just go through your questions, your goals. I can give you tips on what to expect, how to prep for treatments. I can talk to you about treatments that I have done. I can go through patient before and afters, talk about the treatments they have done. But yes, this is like our time. I've been going live more lately, and I'm really here to help educate and to show people that, Botox and filler doesn't have to look crazy. It doesn't have to be overdone. That's always the goal. So let me know if you have questions. And in the meantime, let me see if I have any pictures set up. Oh, I do. I have some. Okay, cool. I have some patients from the other day. Sometimes I forget to set them up on my phone. So not me getting bigger. If I can, oh my gosh, guys, for reals, let me take this down. Could I not be like that? I can go through patient before and afters and showcase some of the people we see. We treat all skin types, all skin tones. We focus on skin health, hair health, natural looking aesthetics. We have weight loss and wellness program in our office as well. But yeah, let me see if I can pull these photos back up without looking so zoomed in. Okay, what do I recommend for, hey Cynthia, sorry. What do I recommend for mid-face sag? So if you're sagging through mid-face, you can use traditional filler like hyaluronic acid or calcium-based filler, or you can do a collagen stimulator like Sculptra, or you can do all natural filler. All natural filler is made from your blood draw. We draw your blood, we spin it in the centrifuge. We separate out your growth factors and stem cells, and we take that and we heat it and cool it, and then we make a gel out of it and we can inject that. So hi April, I miss you so much. I miss the team. April is an amazing physical therapist. I say you're physical therapist, you basically are. But she helped me a lot. And after my children, so she helped bring me back to life. So, okay. How long do those 3 options last? And yes, so you can do your traditional filler is going to give you immediate results. You're going to put it in, you're going to see the lift. Last, I say 1.5 to 2 years. A lot of people get longer out of it. Your body will metabolize and break down the filler. Your natural filler can last for years. The intent with the natural filler is your body making new collagen over time. So new collagen can last for years. However, we are aging. We start losing that collagen mid-20s, and the collagen is what makes things look lifted, looks youthful, looks plump. So we will keep aging, but it's a nice way to get new collagen. I like that. It is made completely from you. The younger and healthier you are, the better the option. The better the results. And she said, and then the other option was dilute radiesse and Sculptra. That is also a collagen stimulator and can last for years with new collagen. So when we are trying to pick which one, some people are like, which one do I choose? I don't know how do I decide which one? So that's coming down to you. Do you want it to be, immediate result? If you want an immediate result, that's when we're going more with the filler. Immediate, and there's different types of fillers that we can choose based on how thick your skin is, how deep your bone is, how much volume loss you have. So I'm using different fillers on different people in different parts of the face, like what we're trying to achieve. If you want the natural route, so some people are like, I only want the natural, and you're okay with waiting for the results. It gets better over time, guys. It's not immediate. You'll see a little bit of immediate lift, but it's not like the full effect is over time. If you're okay with that, it can take up to 6 months to see the full effect. So we have to talk about that. Also, like, the healthier you are, the better you are. So your better results. So if you're like, hey, I'm 65 plus, I've been smoking, I've been drinking, all these things. I'm like, well, your body probably doesn't have the best environment to make new collagen. Do I travel? So we've got 3 clinics, 2 in LA and then 1 in Las Vegas. And so those are my offices. I go to all 3, and we have teams at all 3 under Jossie Skin and Wellness, or we just switched the name to Jossie. The past few years, it's been under my name, Ginille Beauty Aesthetics. So yeah. Hey Kay, I hope you're doing so great. I'm happy to see you. Okay, let me see. I can flip through some more patients. I was trying to pull my life together. I've been so busy today, guys. I was filming some stuff for our new website. Saw some patients. Yesterday was crazy with patients, and I've been meeting a lot of patients from our lives. So that's really fun to connect on here. And then we do our consults and then come in and do the treatments. It's just really cool. And and then just running behind my crazy kids per usual. But these are just some of the patients we see and we have seen over years, and I want to showcase, like, they look natural, they look like themselves, they look refreshed. Like, these are people, if they're walking down the street, you wouldn't think that they've done Botox and filler and all these treatments. And that's the whole intent when we're doing the treatments. We want it to look like you. We want it to look refreshed, never overdone. We want to maintain your features, what you like about yourself. We want to enhance those things and make sure things look balanced. Yeah, and this stuff can be safe for all skin types and tones. A lot of people don't know that. They're like, I've never seen a black woman or an Indian woman or an Asian woman that gets this, and that somebody looks like me. So we really like to showcase all the different things. I'm going to see you soon, really soon. I can't wait to see you, Kay. Yay! Let me know if you have questions in the meantime. You said you're going to schedule a consult. They're all doing your work hours. So let me know, text if there's like one that you just can't ever find a time. Text, sometimes they do them on weekends. And then Mackenzie or Akira, they help answer our phones if you're like, hey, there's no time. Is there anything Ginille can do? Or Samantha, one of our other nurse practitioners. Sometimes we can find a different time. Also, on the lives, I encourage, like, if you want, you can jump on. We can talk through your questions and goals here, like one-to-one on the face. Well, not one-to-one, one to whoever else is in the group. But then people will also send me pictures. They'll send me videos. You can do that, and I can, like, give some feedback. So a lot of people have been in my DMs and like, hey, Ginille, you said on the live, I can send photos. I can send video. They'll send me some stuff. I'll look at it, and I'll, like, give them a little voice message back, like, hey, based on what you're saying, this is what a recommendation is, or I might ask some more questions. Because you guys know I talk a lot. I'm talking a lot because when I do this stuff, I'm like this, like, I want you to understand there's a lot of thought that goes behind picking and choosing which product and how much we use and when we use it and which treatment. It really depends on you, your goals, your skin type, like all these. There's a lot of factors that come in with it before I just can sit down and be like, yeah, let's do Botox on you here and let's do this much. Like, everybody's treatment plan is a little bit different. Okay, let me see if there's other questions I've missed. If I'm going to try to make sure I get them all. Okay, if you have questions, drop them in the chat. In the meantime, I can talk through some of the patient before and afters, and I can showcase some of these, and I can even talk through treatments that I have done. This is me before I did anything. I was 28 years old here. I am now 38 years old. And this is my first little baby. I cut him out, and he's big, and he's 11. And so I have a 2-year-old, I have a 4-year-old, and then I have an 11-year-old. And so I have breastfed all these babies for, like, I breastfeed them all between 2 to 2.5 years. This is after me feeding this happy baby. He's smiling, but I was really sunken underneath my eyes. I was really hollow through my temples. I even feel like I'm getting a little bit of it now from feeding this baby. And my cheeks were, like, starting to kind of, like, get a little indentation there. So I mean, like, I was so happy, but, like, I just felt like, why my face looked like so different? Why do I look like so sunk in? And so at this point is when I ended up getting some filler. Here's another picture of me before any treatments. And this is, again, 28 years old. Like, I was happy. I was just sunken, and I was just like, what is going on? Like, I don't even feel like this is my face. Like, I'm not, like, my face has changed. I feel like I look different. I was just starting to see these things. Anybody that was like, no, you're beautiful. I'm like, thank you. I appreciate that. And I love you I appreciate that. And okay, I'm beautiful, but, like, I don't look like my freshest self. Like, this is not what I'm used to seeing. So I did, at that point, filler underneath my eyes, and into my cheeks. And I later did some into my chin. And I just feel like, and I've done it into my temples and the corners of my mouth. And I'm, like, telling you, like, these are all the spots I've done filler. I did Botox, and do I have the Botox? Oh, this is a Botox photo. This is me before any Botox. Like, I had really strong, they're still pretty strong frown lines. And so I started doing some treatments. I had already been working in medical aesthetics, but when I first started working, I wasn't doing any treatments. I was like, no, I'm young. Like, no, I won't need that till I'm 50. Only for old ladies. Like, no, this is not, oh, black don't crack, Asian don't raisin. Girl, bye. Like, I was seeing, like, the changes on my face. So into my late 20s, early 30s. So yeah, I had Botox to soften there. I also had, like, lines that were, like, getting, like, etched on my forehead. And again, I still feel like I look like myself, because now I can't, like, mad face you so bad. I can still mad face if I want, but it's not so hard. I don't feel sunken underneath my eyes. I feel like I got lifted. I don't feel like I look so tired. And I mean, I'm tired, guys. I'm way more tired than I had that one baby. I got 3 babies now. I've got 3 clinics. I've got a team, an amazing team. But, like, I'm always running around. Like, I'm way more tired, and I don't feel like I look so haggard. And then I really started honing in on my skin. I used to have a lot of acne hormonal after the pregnancies, and like dark spots from them. And so really started honing in on my skin. Now I don't even wear no makeup. If I wear something, I'll wear concealer underneath my eyes for the pigment. But like the hollowness, the depth has all minimized. And like, I still feel like I look like myself. I'm 10 years older. I'm very happy. I was happy then. I was happy now. Like, I'm very grateful. And I know, guys, we don't need Botox. We don't need filler. Like, I know I'm not here trying to force you to do that. That's not it. That's not my like intent. I'm just saying, if you are seeing changes on your face, if there's something you don't like, here's how we can approach it, you know, and I want to do it in a safe way. I want to make sure you look fresh. I want to make sure you look like yourself. Yeah. So just the way, you know, people will get treatments like their haircut or a tattoo or whatever, permanent makeup, or pick which clothes they want to wear and which car they want to wear. Like, these are different ways people can express themselves or help them feel their best selves. Again, I'm not here to try to say you must get Botox and filler, and if you don't, like, what's wrong with you? That's not it. Like, do what's gonna make you happy. Okay, sorry. Let me go back and answer some of these questions. How can I get a consult? Drea's World, I hope you're doing so great. So we can talk on here. You can send a message to me, or like the fastest way is at in my bio. You can click there and schedule, or text the phone number. So on my page, 424-218-4023. I have virtual consults that I do with almost everybody before they come into the office. And during these consults, we go through your questions, your goals, give you tips on what to expect, how to prep for treatments. And so like when our patients come in, and I see a lot of people that are outside of LA, outside of California, outside of the United States, like every time I'm in clinic, somebody has flown in. And so I just want to make sure before we do these treatments, you know what's going to happen. And we talk through all the things. I want you to start prepping for it, avoiding the blood thinners, the alcohol, taking arnica, eating pineapple, making sure our timeline is good if you're getting ready for something. And like, we just start developing that treatment plan during the consult. So I really encourage consults. You can do in-person consults, and sometimes people will do that. But like, if they're just like, oh, I just made the consult, but I didn't know I could bruise, or I didn't know tomorrow's my wedding. I'm like, no, like, we can't do your lip filler the day before your wedding. Some people will do in-person consult if they are like, and we'll still ask them questions like, I have a good timeline. I understand. Like, we go through things. I've been watching Ginille for several years on these. Like, I know all the things. Then we can do the in-person consult. And when they're in person, they're like basically coming for their treatment. But most people will do a virtual consult before. Okay, I'm trying to scroll. Good evening. Would filler help someone's nose appear straight? Yes, we can do. Let me see if I have nose fillers on here. Here's one. I have a bunch of photos. If you go on the top of my page, there's like a nose filler little, I don't know, a series where I talk through like what you can do with nose filler, and here's some before and afters. Here's just a couple. This patient came in, she was young. She was like, my parents won't let me get, I think she was like 18, a nose job, but they said I can do filler. And we did this. So we did this over 3 sessions. We spread those sessions like 6 to 8 weeks apart. Most people will do 2. She wanted like to really make hers like super, super straight. And I feel like this after is like a surgical result, but we did this without surgery. Like, it takes a few minutes to do, like 5 minutes in the clinic. We give you ice. I have a teeny tiny little needle, and then depending on what your goals are, we can camouflage a bump, we can lift the tip, we can, do things to the nostrils if you want them more symmetric. We can create a highlight or a bridge down the center. Here's another one, just kind of show she felt like when she would smile, the tip of her nose would curve down and she wanted it to be straight. Here's another one, she had a little bump. I mean, like, I tell people a lot of time, I'm like telling this girl, I'm like, nobody's seeing this on you. Like, no one sees that little bump. But for her, she's like, hey, I don't feel super, like, I don't feel confident taking pictures from the side. Like, I see the bump. I just don't like it. I just want it straight. I don't want to go through a big surgery. Can we make it straight? So yeah, we did that in a few minutes, and like, it looks great. And she came back at her 2-year mark, because she's like, you said come back at 2 years so we can check in. But her nose was still straight. So she's like, should we do more? I'm like, no, it looks straight still. We don't need to do any more. So that's the goal. Here's somebody, she felt when she smiled, it curved down. She wanted to swoop upward, so we did there. Here's someone from the front. People are like, what does it look like? It's not going to make your nose super pinched in, but it can help create a highlight down the center, so it looks a little bit more structured along the bridge, and that can make it look thinner, but it's not going to be like super tight in. Like, if somebody has a naturally really wide nose, it's not going to make it super tight. That's when I'm like, maybe you can do a surgical consult. So I tell people 1.5 to 2 years that it lasts. Most people will get longer out of it, which is so great. I'm trying to see. She did one too. She wanted like her bump like softened, and she wanted it to go upwards. So some people want their nose tip to go up, some people want it straight, so we can do different things. Some people don't want the bump all the way gone. They're like, just soften my bump, but don't make it so like, I don't want it all the way straight, but I don't want it so bumped. So there's different things. And yes, it can work on, again, all skin types, all skin tones. So these are just a few of them, guys, that I like try to put together on my phone before I go live. But we have like hundreds of photos, thousands of like patient before and afters who have consented and allowed us to share. So I always say thank you to the patients for letting us like use these so we can show what natural looking results look like, because a lot of people don't know what natural looks like. They think that, oh, if someone gets Botox and filler, they're gonna look crazy and pulled and their face is gonna be stiff and they can't move, and I can tell everybody who gets lip filler. I'm like, no, you can't, dude. You think you can, but you can't. So anyway, let me go. I've been missing messages. I want to get some filler with you. Is it required to do the consultation beforehand? I would say really do the consult. Like, it will just help you so you can be prepared. And I've been doing consults. I started the consults in 2020 or 2021. And like, it really made the patients come in and be ready and prepared, and they know what to expect. We talk through everything. We start doing the treatment plans. Now, I know I've been putting out videos, guys, like every day for the past 5 years. So a lot of people are like, Ginille, I've watched all the videos on nose filler or under eyes. Like, they already know because they've been watching. But it is still nice for me to be able to like see you. I have a lot of questions about you before I can say, here's the treatment I think you should do. You know, because like even yesterday I had a patient and she wanted to do like, there's some things she was like, I want my jawline like super, super, super straight. I was like, okay, I can do that. However, at a certain point, if I keep making, I can make it like 100% straight, but then it's going to like make you wide from the front. I'm like, I don't want that. Like, I need you to look good from all the angles. And so she was like, oh, so like me just having time to help explain expectations, you know, so then you can know, or that you know that you can bruise and you can swell, and we can make sure the timing is right, or that I can go through your medications, any medical conditions, and make sure you're an actual candidate for it, tell you to pause certain medications, tell you to start taking the arnica and the pineapple. The consults are really good. So you don't have to do it, but like I highly, like 9.9 times out of 10, yeah, unless somebody just comes in and they do their consult that day and they do the treatment, they're ready, they're set. And they, you know, we do have patients that do that, but I do like to talk with you, even if they come in and like, just do the treatment. I'm still like, I got like 50 questions I have to ask you before I can just do it. Okay. I'm trying to go through and answer them. I'm not, what is baby Botox, Vanessa? I will make sure I scroll through all the questions. If I don't get it, like, you can also DM me and you can send it to me, or you can text the number and we get to every question. So we've had a lot of questions from lives, a lot of people sending their pictures and they just want some feedback, so I can too. So baby Botox, that's meaning where you're doing Botox in a smaller amount to like weaken the muscles. So when people say baby Botox, they just mean like, I'm getting a small little dose of it. How much Botox we do really depends on how strong your muscles are, how big the area is that we're treating, and then what you want the outcome to be. So if somebody comes in and they've got, you guys saw mine earlier, where are they? Really, really strong frown lines. Like, I can't be like, I'm gonna baby Botox that. I mean, you can totally do baby Botox, but like, I would still have like deeper lines there. So the less amount you do, the smaller amount you do, the less that it weakens those muscles, and the less amount of time that it works. So I have some people that want baby Botox for whatever their reasons. I have some that are actors, and like, you know, I can't take all my lines away because I'm playing a cop and I'm the bad cop, and like, I need to like make frowns and I want to have those lines. I don't want them all the way gone, but I don't need them being so aggressive. So we go lighter on the side. When we go lighter, it doesn't wipe the lines all the way out, and also doesn't last as long. So it's something to keep in mind. I have some people that are like, Ginille, I come to you once or twice a year because I'm flying to you from out of state, out of country, freeze my face. They're like, make it last. I don't care. I don't care if I'm frowning or not. I can still get my point across. I can still express myself, but I don't want these lines. Do it up. So the more we do, the more restricted or like frozen-ish it is, but the longer it lasts. Even when somebody goes frozen, guys, it's not like your face is stiff and you're stoic and you can't move. I have done over 200 units in my face at one time. I did it during 2020. I put 100 units just in my frown, like just right here. And it lasted me like almost a year, like 11 and a half months. I got pregnant. I went through, it was lasting forever. So it lasts a long time the more you do. But again, it makes it more restricted. So if someone said frown, I'd be like, I can't really do it. So just something to know. Some people want to be frozen, some people don't. Everything is different, but this is why we do the consult, so we can do something that is going to fit you and your goals. And I will ask, like, what do you do for work? I'm asking, so I'm trying to be like, okay, if you're a priest that, you know, and I treat it, you're a nun, like, you probably don't want to be frozen. And if you're a sex worker, you might want to have like really full lips. So we talk through a lot of stuff like that. Okay, I'm trying to hit all the questions. Certain criteria for masseter tox dosing. So masseter tox, this is your muscles right here, your jaw muscles. We do this if you're having symptoms, TMJ symptoms like clenching, headaches, teeth grinding, jaw pain. We want to relax this masseter and or the temporalis muscle. Both of these muscles are chewing muscles, so muscles of mastication. When you overuse them, if you're clenching all the time, they typically have pain here, they feel tight here and or here. Sometimes it's worse on one side versus the other. Some people, they chew gum all the time, only on the right side. That right side might be kind of bulky. How much we do really depends on how strong your muscles are, how severe your symptoms are, and then what you want the outcome to be. When I say the outcome, I will let patients know it can slim the lower face. I don't think I have a picture of the slimming on here, but I have some. If you want to see it, you can message me about it. It can slim the lower face over time. And so when the muscle is basically bulking up, it'll start to widen and be more square, boxy. When you relax it, it's like, it's atrophying, it's weakening. And so it can't bulk. So it starts to slim out. A lot of people like the look of it. Some people don't want to have it slimmed out. So then we have to talk about, should we do this? Should we not do this? Should we do a smaller amount? So yeah, but usually I'm doing between 20 to 40 units per side on here. I have some people that will do 80 units. I don't start out so aggressive. I will do some and I say, hey, let's measure this. Let's talk about how severe these symptoms are. You got an 8 out of 10 every single day. You've got headaches every single day. When I see you back in 2 weeks, I want to be like, hey, can you tell a difference? Oh, now your pain is a 4 out of 10 and you only have a headache twice a week. Cool. Are you good with that? Or do you want to try to weaken this muscle or the temporalis muscle some more? So you guys know I talk a lot because I'm trying to make sure that whoever is getting treatment, they understand the treatment, you know, they understand why we're doing what we're doing. I'm not just randomly poking your face. I'm not just being like, I want you to get what we're doing and why. I want you to understand limitations of it. I want you to understand what to expect. You know, because some people, sometimes they get online, they're like, I did Botox, I don't see any change. I'm like, well, when did you do it? They're like, yesterday. I'm like, no, it takes 2 weeks. Like, your provider didn't tell you that. It takes 2 weeks to like see the full effect. So it's a lot of education that we do. We want you to be informed and make informed decisions, not quick decisions. We're not trying to just do random things on your face just because you saw a TikTok trend. That's not it. I want to make sure if we're doing something, it's going to fit you and it's not going to look weird, it's not going to be overdone, or just again understanding the limitations. If you're just like, make me like this, I just put filler, keep putting filler until it pulls back, I'm like, I can't, like, I realistically can't. So yeah, okay, I'm going to try to hit these. Can I get Juvederm under eyes? Do not. Regular Juvederm is there's different types of Juvederm. Juvederm is a brand of fillers. There's different ones. Traditional Juvederm, which is like one of the first fillers I ever was trained on when I started in this at 2013. It binds a lot of water. I don't even buy it in my office. I don't buy traditional Juvederm. I don't buy like the old school ones. They're cheap. So a lot of people do buy them because then they can sell them and get higher profits off of it. But like, the product technology is so much more advanced than when I started 13 years ago. Like, we have new products that integrate better into the skin. So they're not leaving lumps and bumps and bumpy lips and puffy above the border. So I'm like, I don't even mess with that product. I don't care if I can save $50. Like, it doesn't matter. Anyway, traditional Juvederm binds a lot of water. All of the fillers have an affinity to bind water. They're hydrophilic. So it just means like they can get puffy. They're going to bind water to it, which is nice. You know, you might want that for like your lips if you want to be hydrated. If you want to have like a more of a lifted look. Let me see here. But if you don't want that underneath your eyes, because then it could like hydrate up. If you're crying, if you've got allergies, if you wake up in the morning and you've been laying on the face, it could be really puffy. You don't want that. So don't do that regular Juvederm underneath your eyes. There's other products that you can use just not that specific old school Juvederm. I will use like Voluma under somebody's eyes. It doesn't bind water as much. If their bone is really deep, like if they're a candidate for it and they have good thick skin, the products, I don't usually come on here and be like, use this one or this one or this one. I really don't do that, and I never have, because I have to choose different products on different faces. Like what I'm going to use on her face is going to be different than what I do on her face and her face. Like everybody's face is a little bit different. So we choose different products depending on who we're treating, the area of the face we're treating, what we want the outcome to be. So for him, if he wants more of an angular jaw, I'm going to do like a more sturdy filler. A girl might not want to be so angular from the front. So then we need to use something a little softer. This is why we got to talk it out. How much fat is in your face also determine. When I say fat, I'm meaning like fat, like the fat pads in the face. So like as we get older, we start losing fat pads. So like it's going to be different how I treat her versus, this girl. Like even though they're both white women, it's going to be different. So these are all the things that we're considering. Okay. Let me make sure. I'm trying to scroll back to the top and see if I missed any. We talked about the consult. We talked about filler in the nose. How much for full facial balancing? So that depends on what part of the face we're doing, and that depends on the face. So typically when we're doing full facial what is facial balancing? That means we're basically customizing like your treatment with your filler, with your Botox to make you look fresh. We're looking at signs of aging. My team, we're thinking about how you are aging underneath the skin. Where are you losing volume? So like me getting facial balancing today is going to be different than there. So it's just like how you present. It's going to be different. Like where are you losing volume? How are your features relative to one another? Let me show you a girl. Like this is a good one. Like she naturally had really full cheeks and her chin was really back. Like she didn't need more cheeks. She needed more chin. And so more like jawline. So that's where I focus. We weren't doing the upper face. Whereas somebody like Sujia here, we did upper face, smile lines, lips, corners of the mouth, along here. So different things, depending on the face. Like it just varies. I will say in general, a roundabout number is like 2 to 3 syringes for the mid face, 2 to 3 syringes for the lower face. So that's anywhere from like 4 to 6 syringes. However, it can be more. It can be more depending on what you're trying to do. When you start talking about temple, like all the things. And if you have more volume loss, I've got people that, hey, I lost 50 pounds. I lost 100 pounds. If they have more volume loss, we're going to be using more filler. If your face is bigger, we're going to be using more filler. If you have a little petite face, then like, oh, we don't have to do that much. If you're just skin on bone, meaning I put the needle in and I'm hitting the bone, I only have to use a little filler to get a lift. If I put the needle in and you have more fullness in your face and I'm like, oh, wow, your bone is deep. You got more fat here. It takes more product to create that lift. So anyway, having said all that, the syringes at my price are $9.75 a syringe. So when I said like 2 to 3 here, 2 to 3 here, anywhere from like $4,000 to $6,000, around that number. Again, guys, this really depends on the face and what's going on. I have people that will spend more than that, less than that. It depends on their goals. Like this girl came in, like she wasn't talking to me. She's like, I want my nose. Like this is my concern. And she's young and she's like beautiful. Like she didn't need anything, but she's like, this is my thing. She didn't say to me, I didn't say just because her nose thing, I didn't say you also got to do your lips and your temples and da da da. Now, if I see something when I'm doing it, because when we treat areas, like I want to tell people, we have to consider the full face. We have to consider how treating one area may impact another area. So, if somebody's just like, I only want to treat my smile lines, I'm like, okay, but you didn't just lose volume here. You also have like this deep line from, and through the middle part of your face, like the part of your cheek. So if I just fill this line and then your cheeks are still kind of sagging, it's going to look a little weird. Like people won't know what happened, but they're going to know it looks off. So I'm like, if I only treat your line and this is puffed out and soft, but this is deep, and then you got those old lady lines here and your chin is set back, that can look a little off. So when I'm talking to the patient, I'm saying, hey, these are things that we want to consider. It is never, you gotta do this. Like, that's not it. It's just not my style. Probably more often than not, I'm saying no to people for a lot of things. And any of my patients know, they're like, I know you're about to say no. I'm like, if you know I'm about to say no, then like, why are you gonna ask me? But like, they can ask, like, we can talk it through. I want to make sure if we do something, it makes sense. And I just don't, I understand these products very well. I understand how the face ages. I understand anatomy. I understand the bones and the fat pads and the muscles. And because this is what I do. This is what I study. I've been doing it since 2013. I went to Stanford. I went to Duke. Like, this is what I do. The normal person might not understand that. Now, you take me to a car shop, I will not understand anything about a tire. You take me to any other thing that I'm looking at around here, like, I'm not going to understand it. This is just not my field. So this is like what I specialize in. This is what I know. And this is why I try to educate, and I try to make it like as simple. I know I talk a lot, but I'm like, I want you to understand all the things and like why I may or may not be able to achieve something that somebody's asking for. Okay. Let me let me go through the questions. Sorry, guys. I'm going to hit down and I'm going to scroll and hit them all. Come to Texas. Texas and New York. Guys, those are the next two. Because I hear New York every day. And I hear Texas, and I see a lot of people from Houston and Dallas. Those are the main ones. Is it true that master Botox causes jowls? I don't think it causes jowls. But if your muscle is like wide right here because you have used this, you have a lot of support. It's kind of like tight. When you weaken this, if this is now going to go in, that's when they feel like they can see this little skin right here. It's not like it makes it you have a jowl. We all have this little fat pad. As we get older, guys, as we start to age, lose volume. Let me try to show you. This is the jowls, this little fat pad here. So these fat pads separate. This one keep coming down. And you can see along the jawline, it just doesn't look as straight. So look in the before, kind of showing this. So we all have it. So that's when we can use some filler to camouflage it. Masseters, people love it, guys. Like, they say it changes their life with Botox. If they're coming for like TMJ symptoms, clenching, headaches, teeth grinding, jaw pain, they're like, I just don't suffer with TMJ. And it's like, my life has changed. I have seen it twice in my career. I've been doing it since 2013, where I felt like it didn't look that great aesthetically. When I was like, I don't know if we should do this anymore. Those two cases, they weren't friends. They didn't even know each other or anything. One was a girl that was a law student, and one was a girl that was a medical student. And these girls were coming to me, not, no same timeline. This is just my whole career. Coming to me like every 2 months. I'm like, just do it. I'm like, your muscle's not even flexing. Like, they're like, no, do it. I can even feel it. If it wears off a little bit, I feel it and I have pain, and like I can't get, I'm like clenching and grinding my teeth. I've broken teeth. I'm so stressed with what I'm going through. And so we like weakened this muscle so much that I felt like their face looked really, really slim, and I didn't think it looked good. And I was like, should we not do this? And they're like, the aesthetic thing is not my concern right now. I need to get through school. I need to get through life and like handle it. And I have seen them back since after, and like they're not having to keep doing this, but they were really trying to get through like a stressful time. But other than that, I have not seen people like, oh my gosh, I hate this Botox. I can't do it. Like they really like it. Okay. What days are you in Vegas in December? Andre, I don't even know. December gets a little crazy. I'm there on this Friday though, on the 11th, and I think I have a January day. December, I'm not 100% sure if I'm going to be there. I just got my teeth removed and my jaw is recessed now. That happens, and I see that. I actually had a referral from an oral surgeon for a patient for a similar thing, and like sometimes when they're missing teeth, sometimes I can tell like when I'm injecting them, or if like one side is more like sucked in than the other. I'm like, have you lost any teeth? Are you getting any implants? What's going on? Because like they don't have the support in the mid face. And so, yeah, it kind of gets a little sunken. Things you can do, possibly some filler or a collagen stimulator. But I really will talk to the patient and be like, hey, are you planning to get an implant? Are you planning to get the dental work? Because getting some support in there is going to help the best. Okay. What kind of laser do you recommend for sunspots on darker skin? Aerolase. In our office, guys, I haven't talked about skin. That's like a main thing in the office. So in our office, we have a skin membership program. And you guys see, again, we treat all skin types, all skin tones. We see everybody in our office. I need to have treatments that are going to work on everybody. I am Filipino and Black. Like I need to do treatments that I can do because I've been in this a long time, and there's been so many treatments that Black and brown skin can't do. But Aerolase laser, excellent for fine lines, pores, texture, dark spots, acne, redness, inflammation, hair removal. Yes. So that, and all those, I need to get those photos so you guys can see. My neck used to have all those little like moles. People say Morgan Freeman. I had a bunch of them after my pregnancy. They all went away. So the Aerolase is great. There's no downtime with it. You can do it on Black and brown skin. You can do it on everybody. Everybody likes that. We also in our office have BioRePeel chemical peel. I think this works really good for pigmentation and for brightening. Minimal, if no downtime, or very, very minimal. You just get a little bit dry, flaky. It's not like sheet peeling. So I like that. The microneedling skin pin is great as well for dark spots, again, safe for black and brown skin. And hydrofacial, that's more for like hydrating and deep cleansing the skin. So in our membership, you can come on a monthly basis. We choose one of those 4 treatments as like your base thing that you do that month. It may change from month to month depending on your skin concerns. Because you know, we do a lot of talking, we do a lot of education. Your skin changes throughout the seasons, throughout what's going on. So we might be switching it up. We can also combine these treatments. So a lot of people will be doing like 2 or 3 treatments in the same day. They work really well together. They work on different layers of the skin. So this is why we got to consult and see what your concerns are, all the things. But the biggest thing for sunspots on darker skin, if you don't want to do any treatments, especially, and even if you are doing treatments or you're not, you got to wear your sunscreen. And gosh, I have like so many sunscreens in my car all the time. Use your sunscreen and reapply it. Yes, on black and brown skin. I will tell you guys, people will come in like, I didn't know I had to do it. Like, I thought we were good. We had the melanin. I'm like, I know, but now you're here with these like dark spots and your skin is really uneven right now. And like, it's harder to treat on black and brown skin. Like, we can't go as aggressive on because there's a risk for like burning and all that. So that's what I'm like. The number one thing is your sunscreen. And then if you can use a retinoid at night. But like, if you can only give me one, wear your sunscreen and reapply it. You will see your skin, like, things get lighter from just like getting the sun protection. We get sun on us in LA. We're driving. We're by windows. It's always sunny in LA and in Vegas. So like, yeah, that's going to be the number one. And yeah, what about Botox for hooded eyes? Yes, you can do Botox for hooded eyes. So Botox around the eyes. This muscle is usually like a circle. This muscle is a circle and it closes in. So when you Botox it, you won't close in so tight. It'll help to lift a little bit. You can also, more advanced, do Botox right along the eyelash line, like right on the eyelid, and that'll help give a couple millimeters. Botox won't take away excess skin. If you're like, I have a lot of skin here, you know, it can give you a subtle lift. It's not going to be woo up there. If it's a lot of excess skin, that's why I'll talk to patients. Hey, do you want to do a surgical consult? You know, there's only so much we can do non-surgically. But yes, it works well and people really like it. Other things you can do for people that feel a little sunken here, we can put some filler or a collagen stimulator in through their temples, and that'll give a little support. Sometimes make the eyes appear a little bit more open and have some support there, like along the brow. Okay, is there a treatment that one can get with active acne? Island girl, do that Aerolase laser. 1,000,000%. Oh, Claire is here. I wonder if Claire's gonna come in. Do the Aerolase laser day in, day out. It works so well for acne. We treat a lot of acne in our office, and then you can do the bio repill chemical pill as well. We also do prescription medications. We prescribe and dispense. I'm a nurse practitioner. We have other nurse practitioners on our team. We have a dermatology nurse practitioner on our team. So depending on your skin concerns, we can prescribe and dispense medications, but we treat a lot of acne on all skin types and all skin tones, and that laser works so well. And not just for acne. So it's like going to work on killing the bacteria and killing the inflammation and the redness, but you're also going to get just overall skin rejuvenation. You can get some hair removal. You can get like all the things with that laser, and there's no downtime with it. Usually I would say for acne, about 2 to 3 months of them coming in twice a month. And then they start being like, dang, like my hormonal, like it's not happening like it was. Either they don't have to come anymore, or if they're coming, we're kicking it back to like once a month. And then we're at home really maintaining you on a good skin regimen. Okay, I'm still scrolling, guys. I'm trying to get through all the things. Come to Texas, I got that. Good for you not using Juvederm under the eyes. They said it messed their eyes up. Yes, I know these products, guys. This is all I do. And I don't choose like off of price. I don't choose off of what I know, because I buy from multiple lines right now, and the companies are like, Ginille, if you just bought from our line, like you can make so much more money. I'm like, yeah, but I can't if the result isn't great. Like, it doesn't make sense. Like, I'm not trying to save $50. I'm trying to get you a long-term good, not even good, freaking excellent result that you can be happy with. Like, I don't want you to have a bad outcome. Like, that would not be good for me at all. Like, I want you to feel and look great. And also, guys, read the reviews. Like, I've been doing this a long time. If you look under my name, read the reviews. Look at the patients. They're posting their pictures. They're posting their videos. It's not just me talking about it. And like, yes, again, shout out to my patients for sharing. But I'm like, do your research. I tell people, I'm like, do your consult. Don't just like, I'm here. If they're like, should I do this? I'm like, no, you shouldn't. Like, go think about it some more. Don't rush it. This is not for me to try to convince you. That's not it. I'm here to educate you, inform you, help you make an informed decision. If you want to do these things, I'll talk to you about the limitations. I'll talk to you about what we can expect on the treatments and all that. Claire, I love you guys. Claire is one of our providers. She said, what's my absolute favorite treatment? Claire, she knows they all do it for me. They've all injected my eyes with Easy Gel, my temples. It's the only thing I can do right now besides the skin treatments because I'm breastfeeding. But guys, go see Claire. Actually, anybody in our team, I love these girls. Like, I stand behind them 1,000,000%. People like, I want to see you. I'm like, dude, I can't see every single patient. And I would not bring on people that I did not stand behind 1,000,000%. I'm not going to bring on somebody that's not going to get you a good result, because if they don't get a good result, like, it's on me. Like, I've got to stand behind it. But these girls are excellent clinicians, like excellent results. Their patients, all the patients love them. But go see Claire, and she's so freaking wonderful. She's like a ray of sunshine. Okay, let me see. Come to Kentucky. Thank you. I'll have to check out one. I don't have my license there. I have my license in a lot of places. Okay. I have dark circles and pigmentation. Can filler help, or should I try something else? So if you have hollowness, sunkenness, volume loss, filler can help. Usually people will have that and pigment on the skin, like their under eye color is just darker, but it like looks even more dark because it's sunken. Let me see who's here. Hey Taylor, I hope you're doing so great. So if you have the sunkenness, usually when we lift it, it can look brighter, and then it's easier to cover like with concealer if you want. Hey Taylor, I'm going to see if I can see. Oh, she went out. Okay, Taylor, if you want to come on, you can. You guys can totally come in here and like we can talk one-on-one. As long as you don't get puffy under your eyes, as long as you don't cry a lot, have bad allergies. Anybody that retains a lot of water around their eyes, filler is not good. So yeah, that was me before. This is me now, guys. This is me 10 years ago. This is me now. 2 more babies on top of that one. And I don't feel like I look as sunken and tired. Let me see. Yeah, it just helps. Like, this is helping to camouflage that fat pad. Like, she still looks exactly like herself. She just looks not as tired. Like, that's just it. She's like, I just feel like I look fresh. And that's all we're trying to do, is like make it look like you just rested and refreshed and nothing crazy. Okay. Let me see. What type of insurance you take, and where in LA are you located? We don't do insurance. Yeah, medical aesthetics is not like this is all, what do they call it? Like, you don't need it, unnecessary. So this is just for people if they want to invest in that. In Los Angeles, we're in Mar Vista and Torrance. And then, let me see, but we do take Cherry financing. So that is a program. We can send you the link, and like you can get pre-approved before we even come in, so people will know, oh wow, I got approved for $5,000, $10,000. Hey, how can I? And then you can break up your payments if you want, like based on whatever we're doing. Oh, I want to break up my payment over 3 months, over 2 years, whatever, you can break it up. So patients like that. There's also different rewards programs we'll have you register for, because remember, I buy from all these lines. Sometimes I'm like, it's a free clinic. So there's different rewards programs you can do to get like little discounts from the companies that make the Botox and make the fillers. Okay, let me see. Where are you? Where are you located? I think is that what you're saying? Please reply. Where are you? I'm in Los Angeles. 2-tone lips. Hold on. Let me see if that one. 2-tone lips and lip filler. Thinking Giles would be better. I don't know what that means. And lip flip. 2-tone lips and lip flip. The filler or the Botox is not going to change the color of your lips, if that's what you're meaning. Oh, maybe you're thinking filler would be better. Filler is good to volumize, plump, hydrate the lip. If your lip, when you smile, curls under, or when you smile, it goes up, that's when we can do Botox. Botox above the upper lip prevents the lip from curling in. And so people will be like, oh, since my lip doesn't curl in, my lip doesn't disappear when I'm smiling, it's more forward facing, my lip looks fuller. Or some people, when they smile, their gums show a lot. It goes up and their gums show. That's when we can do Botox right here. And that'll weaken the muscle so the lip doesn't go up so much and their gums don't show. Suggestions for crow's feet. Divine, hey, you could do Botox there. That's like the quickest, easiest one. You put some there. So this muscle here curls in. When you Botox here, it'll soften. How much you do determines like how softened those lines will be. So some people have a lot of lines, they're going to do more. Some people have just a little bit. They just want to soften it. They want to keep some of their lines. They're going to do less. The more you do, the longer it lasts. Okay, let me see if I have, she said that one. I'm Black and Japanese, and Halo, Jack Me Up, and Arrow Lace is amazing. I'm so happy to hear that. Be careful. I'm Filipino Black. Be careful, guys. And this is why I try to get on here and showcase people and show different skin tones and show different faces, full faces, smaller faces. I try to show all the people, old, young. men, women. I try to show everybody, like, this is, we do face. We do face, we do skin, we do hair, we do body. But like, we are very like dialed in on you and your skin. And like, we have so many questions particular to you before, even if you're like, hey, I love these lasers and these are super safe for everybody. But before I can just start zapping you, I'm gonna be like, hold on. What are you doing at skin? At home for your skin? When's the last time you did a treatment? If you've done treatment, when's the last time you've had sun exposure? When are you about to be out in the sun? How is your skin right now? Like, I have to have a lot of questions before we can do the treatment, because I want to make sure you can do it, you're the right candidate for in that moment. So this is why we do a lot of talking. Okay. What's the average cost for under eye fillers? So under eye fillers, I do it in 2 sessions. It covers both sessions and it lasts 1.5 to 2+ years. A lot of people get longer out of it. I think it is like $22.50 to $27.50. The numbers are on the website. The website is changing. But if you also text me, and then how it determines, like, oh, people are like, which one am I going to be? Or I just want to be on the lower. I'm like, okay, I don't know until I put that needle in you and see how deep your bone is. Somebody with a deeper bone that uses more hollow, more sunken, that used to use more filler, it's just, the cost is more. Somebody that's like, sometimes I have, you know, these young, like, him is more. He got more hollowness, more sunkenness, more volume loss. Her is less. She's young. She doesn't have that much. Less product. So it just depends on the person. But though it covers 2 sessions, I have you do some. I have you come back in 6 to 8 weeks after. See, she's a little poked up in the after. You can bruise. You can swell. I want that to settle. And then I have you come back and I say, do I need to fine tune anything? If it is perfect, cool. We don't need to add it. But I have that appointment built in case, you know, the bruising and the swelling, and I want to fine tune it. When I do the eyes, and we don't just do here, I go all the way around here, because I got to look at you and see where you're losing volume. A lot of injectors, I think, just go right here. They see this line, but I'm like, it's not just there that we're losing volume. Like, we're losing volume along this whole orbital rim. You can kind of see this little shadow on me. I'm gonna have to have one of the girls put some natural filler there, but like, we're thinking about the whole thing. Other thing is, we got to make sure it's not just your eyes, but like, if you have sunkenness in the cheeks as well, that's when we talk about, hey, should we be doing this, or else this part's going to be lifted and this is going to be sunken. It's going to look a little off. How do we make things look seamless? That's the biggest thing. I don't want it to look like you've done anything. The way to do that is like, make sure everything is all seamless. Okay. I spoke to my nurse. Radius from my mid-cheek group, and she doesn't recommend it. Why? Dr. Jennifer, let me know why. Let me see if I can see your picture. I don't know. So I use Radius a lot. However, it depends on the patient and what's going on. Where I wouldn't do it on somebody, if they're like super thin skin on bones, like Radius is a calcium-based filler. It mimics bone. I feel like out of all the fillers, it has the most lifting capacity out of all of them. It gives the most oomph. And I treat, you guys seen all the people, all skin types, all skin tones, everybody. She has a bunch of Radius in her face. She's documented this and like made videos and tells you guys about it. She got a bunch of Radius in her face. I got a bunch of Radius in my face. I haven't had it for 3 years because I'm breastfeeding, so I've been doing the natural filler. Radius, like him, Radius. If somebody's like super thin on like skin on bone, there's no fat in their face, maybe that's where I would choose not to do Radius, because it might be a little too structured for them. I don't think a lot of injectors use it. They're just like, they want to use the hyaluronic acid fillers, and they're great too, but they don't do the same exact thing. Radius gives us a little bit more oomph. It stimulates collagen. It mimics bone. So spots I cannot inject it with, under eyes and into the lips. It's too thick for those areas. But you can also ask her. I don't know. Did she give you like a reason to tell me more. Hope I feel better soon. I know I'm tired of that. I don't even know if you're talking to me, Divine idea. Okay. Have you heard of perioral mounds? It's the fat pads by the mouth. Okay. So that's when like, some people will look like they have like this, and then it's kind of like sunk in through here. I think that's what you're talking about. So yes, even yesterday I was treating a patient. And so like, if you have volume loss here, we're going to do into these shadows. And it's like, this part will look kind of like full, and then this is kind of like sunk in. So that's what we'll put filler here. Yesterday I was doing a girl. We did her chin. I was like, good girl. It's not just your chin. Like if I bring your chin forward, I'm going to have a ball of filler here, but I got to bring forward all these other areas as well to make it look seamless. Now, if you want me to make it look weird, I can do your half syringe and just put it right here, but then this is all sunken and like, it's going to not look right. So we want to do it, and then we got to blend it through. So yeah, you can blend those areas so it doesn't have like the little shadows, the indentations. Okay. How much for filler? How much do your fillers range from? $9.75 a syringe. I don't care the brand. Because I don't want people saying, well, that one, I can save it for $50. Like at the clinics I used to work at, oh my gosh, we had a price difference for every single product. And so then the patients were trying to tell me, I want that one because it's $20 less. And I'm like, but that's not the one that's going to get you the outcome. So I got rid of all of that. And I just make them all the same price. And they're like, Ginille, you can make more money because it doesn't make sense that you have them all the same. I'm like, guys, I know I lose money if I pick that one versus this one, but like, do I get the result? That's the biggest thing. Do I get the result for the patient? If I get the result for the patient and they're happy, then that's what matters. That's what will help the business grow. Like they're happy, they're going to tell their people, they're going to share their experience. That's what's it. So I go for the result. The team, we go for the result, not for saving $1 on your Botox or my cost. Like, no, I'm not trying to do that. Okay. Let me see. Thank you, said I'm beautiful. I appreciate it. It's our first time meeting. What Botox do you recommend to slim the nose and help with, oh, I missed that, nasal flaring? Botox, Dysport, Xeomin, Jeuveau, Daxxify, Ledibobo. I think those are the ones that we have in the US that are all FDA approved. In our office, we do Botox, Dysport, Xeomin. I like them all. I say try the different ones and see if you can tell a difference between the brands. A lot of people are like, I can't. Start with Botox. It's been there, tried and true, been forever. Botox for nasal flaring. It can help the nostrils not flare so much, and then it can do some at the tip of the nose to prevent the nose from like kind of curling down when you talk or smile. But I think you like that. It is a little pokey on the nose. That's like a more sensitive one on the nostrils, just so you have a heads up. Come to Texas. Okay. I'm sorry. Oops. I'm trying to make sure that I hit all the questions. How long can I go in between filler sessions? So in the beginning, when we're trying to get to your goals, I say 6 to 8 weeks, like for me to reassess the area. 6 to 8 weeks for the product to settle. That's where you like won't feel it. You won't feel the little bumps. It's integrated into the skin. So after that, come back. If you're like, Ginille, I liked it when it was swollen. I want a little bit more. We can do it, but I won't do it before. Some people are like, well, my injector let me do it at 2 weeks. I'm like, 2 weeks, you still got like little bumps. Like I still feel the product. No, I don't want to be injecting on that. Also, I have a false perception of what the true result is because it hasn't settled. So 6 to 8 weeks, let it settle, come back. If you want, we can do more as long as, it makes sense. If it's something where I'm like, I realistically can't get what you're trying to achieve, I won't do it. After you get to your goal, I tell people 1.5 years, 2 years, check in. If you've had a bunch of like changes, I lost a bunch of weight, maybe we're doing more. Sometimes people are coming, I'm like, you still look fresh. Like, we don't need to do this, but like, let's go hard on your skin. That's always going to be the biggest one. Like, go hard on your skin. Okay. Hi. Is it a red flag if a nurse in a med spa is using a doctor pin for microneedling? There's different brands. We use Skin Pin. And when I was choosing, there's a bunch of brands that you can pick. I went with Skin Pin, and they're the friggin' most expensive one. And again, people are like, you can save money, Ginille, if you did this one. I talked to a lot of colleagues before I did it with all different brands. And I remember, I'm not going to say the brand, but one of my colleagues, a true friend, and I was like, do you like that one? And he was like, yeah, it's good. I was like, why do you say it like that? He's like, well, like after the treatment, we have to like clean the blood, like outside of, like inside with a Q-tip. I was like, what? Like cleaning blood? I was like, boy, I don't have any time to be trying to mess with like potential, like just passing blood from one patient to the next. So with Skin Pin microneedling, they have done so many studies on their skin, on their device. And one of the things they said they did, they're like, we purposely tried to like infect the pin with HIV. Like we tried to put blood in it. They said, this is a completely sealed device. There's no way anything can penetrate inside. They got study after study after study. And so, yeah, we've done that one. I'm like, whatever, it's the most freaking expensive one. But I'm like, I'm going to go with the one with the most research and the safest, and it's going to get the results. And it works well. I haven't had issues. Guys, I also pray all day. I'm always praying. Like, God bless it. I want the patients to be great. I want to have wonderful outcomes. Like, that's just where my heart is. But yeah, like I haven't had any issues with these things. If I did, guys, I can't be on here telling you to do it. Like it would not be beneficial to me or to anybody if I'm like, do this thing and it doesn't get the result. There are several things I have worked with in my other treatment, other medical spas before I went on my own that like weren't getting the results and like weren't safe for black and brown skin, like just stuff like that. And I'm like, why? Like I can't do this. I have been in this since 2013. Like I have seen stuff come and go and they hype it up and they put a lot of marketing dollars behind it and they get patients excited and they get providers excited and then they don't get freaking results or unsafe. And then I'm like, that thing died down. So I have learned when new stuff comes to the market, I just I just silently watched for a while. I'm like, let me see this for like a couple, 2-3 years before I start saying, is that something that I'm going to risk myself with, that I'm going to risk my patients that I trust with? And so, yeah, I'm like, oh, somebody's like, oh, you're a Virgo. I was like, what does that mean? They're like, you're just like a little extra, like you want to be a perfectionist. I was like, I don't want to be a perfectionist, but I want to do like the very, very freaking best I can. And I'm dealing with your face. I'm dealing with your face. I'm like, that's an honor and I take it very seriously. So I just want to get the freaking best result for you. What did I do to my nose? I didn't do anything to my nose. That's the one thing I haven't done. Only because once I started having my kids, I started being like, dang, this is the one little Filipino and black thing. Like they got the same full nose. I'm not going to take it away. Get rid of these under eye hollows though. Get rid of these temple hollows. Get rid of this recessed short chin. But I kept the nose just for them. But sometimes when I'm doing my patient's nose and I'm like, dang, like her nose looks so good. Should I just make this bridge like a little bit more, like a little bit tighter? But I'm like, oh, I want to look like my kids for now. Okay. I think, what did I do for the under eyes and to lift brows? I did filler. This was a long time ago. And then I have since done, the past couple of years, I've been doing the natural filler. So draw blood from your arm, spin in the centrifuge, take out your growth factors, your stem cells. This is what I've been doing on me. My team's been doing that on me. We heat it and cool it. So it's a gel made completely from your own blood, a natural filler. You can inject that anywhere in your face. I've done my eyes, my temples, my smile lines, my corneas, my chin, all the spots. It makes new collagen over time. I feel like that has really helped hold me over these past couple of years because I can't do Botox and filler when I'm breastfeeding. But yeah, the natural filler you can. I've been doing skin treatments. Does the price of the consult go towards what you get done, or is that just for the consult? So the consult virtually is $150. It goes towards your treatment if we do treatment within 3 months of our consult. In person, it's $350. It goes towards your treatment that day. If you don't do it that day, it just goes towards, that was the consult fee. Okay, thoughts on microneedling? I think it's great. Sorry, guys. These are probably like questions from a while ago. I'm scrolling back and then I go down and swing back. Can PRP be used in facial balancing? Yes, I've been facial balancing myself with the natural filler for the past 2 years. What did she do for under eyes? That would be, I don't know who you're talking about. If you're talking about me or a different patient, but it was probably filler or the natural filler. OMG, my December appointment cannot come sooner. I just came in to say hi. Hi, Marie. I hope you're doing so great. I can't wait to see you. Make sure you start taking your arnica, your pineapple, avoid blood thinners, avoid alcohol leading up to it. Let me know if you have questions before I see you. How long should Botox last? I got it for the first time and my forehead was moving again at 1 to 1.5 months. Lauren, so it depends on how much you're doing. If it's wearing off that fast, it might be a baby Botox situation. So yeah, usually 3 to 4 months it lasts. However, I don't know enough without talking to you, Lauren, but if it's just moving, I expect it to like maybe have some movement, around 8-ish weeks, but it shouldn't be like back to 0. So I tell people it's not like you do Botox and then at 3 months it goes from frozen to unfrozen. It's like gradually, like the lines are and the movement is starting like to wear off during that 3 to 4 months. Now, if you want it to be long, like last longer and be more frozen, you do more. So the more you do, the more frozen, restricted it is, the longer it lasts. I'm going to go in a minute to watch my kids last a little bit of his practice. Is your Vegas location less expensive than LA? I will be there. The pricing is like the same. For when I go there, my price is the same. Our Botox, it's the same. It's the only thing in Vegas is they have a rule where we can't do like per unit Botox. And so you have to buy the vial. That's the only like kind of annoying thing. But otherwise, the pricing is the same. We see so many patients from like, I have a lot of patients that go back and forth between either of them. Okay, I'm going to try to go invasive. Okay, how often? Oh, there was something. How often would one need more filler? I got a lower bleph, but if I could get something less invasive that I don't have to keep getting touch up, then I would. So is it for under eyes? I say 1.5 years to 2 years. Most people under the eyes get a lot longer. This area is like not moving that much. I did my under eye filler like 8 years ago and I never redid it. I've just been doing the natural filler for a while. Okay, I'm gonna hit these if there's any last little ones, and then I'm gonna go watch a few minutes of my kid does fencing. I think it's so cool. Worm fill across smile line from filler. It was more than a few jabs. Worm fill. What does that mean? So if you just did your filler, you might feel it. So if there's something in there, 2 to 3 weeks, bruising, swelling, that's getting less. 6 to 8 weeks for the filler to completely integrate into the skin where you shouldn't be filling it. If it's been beyond that and you're still feeling it, and like, especially if it's visible, I'm like, go back, talk to them. Do I provide remote consultation? Yes, we do virtual consults. Okay, so I'm going to wrap this up in a second, guys. If you text the number on the top of my page, it's 424-218-4023. You can send me pictures. The team helps. Like, they can send you the link to help you, or you can even hit the own link to book the virtual. I like to do the calls. We can go through your questions, your goals, tips on what to expect, how to prep for treatments. I see patients from all over the U.S. and outside of the U.S., all over the world. We've seen people from everywhere. And we like basically prep you. So before you're just making the flight in, we talk about, okay, is this a good timing? And like, hey, you can bruise and swell. What are your events? Hey, what medications you're taking? What medical conditions? Hey, I actually don't think you're going to be a right candidate for that. Or, hey, I want, like, all the things we talk through during the call. And then we'll say, hey, I probably want to see you back at this point. Is that going to line up with you and whatever your events are? So we go through that, and the patients come in and they're prepared. We've already built out like that treatment plan. If for pricing, like, we'll send like, hey, here's an estimate on the pricing. If they want to do financing, they can start doing their little financing thing is like, take 2 seconds to apply online, but they can know, yeah, I got approved, $5,000, $10,000. So they'll be like, hey, I can break it up into payments. It shows you what you can break it up. So that's what we like to do, the calls. And you're not just coming in to be like, hey, like, I'm just here. Like, can I do this? And I'm like, no, you can't. That's not you're not the candidate for it. Oh, I didn't know I could bruise. Like, no, you know all the things. Like, we try to tell you everything. Plus, I try to get on here, make videos. I'm making videos, guys, every day for five years. Is it bad to give baby Botox? You have to get it so frequently, like build up a tolerance? Yeah, possibly. Yeah, I'm with you on that. So I don't know if it's bad. Like, how long you don't want to be doing this all the time. So the Botox tolerance thing, like, back when I was like younger, like in my first med spa, I would only see a couple people where I'd be like, dang, their Botox didn't work. Like I'd been there for like 8 years. I was there for a long time. That it didn't work. And it's like, if they had been doing Botox for like 10 plus years, every 3 to 4 months, that's when they would say it didn't work that well. I feel like after 2020, like, I don't know what was going on, everybody getting sick, all those things, like, that's when I started hearing people say, oh, it didn't last as long. Like, they started, like, there's one girl in my office, and she's been a medical assistant with me for several years. She's immune to it. Like, and she'd only been getting Botox for 2 years. And we've tried the different brands. We've tried to take a break and go back. This girl still, like, it used to work. I used to Botox her and work, and now it doesn't. So I don't know. Your body may build up a tolerance against it if you keep getting these small, frequent doses. Yeah. Okay. Let me see if there's how often do I do PRF Easy Gel? I've done it several times. I've done it, I don't know, probably 6 times, because, like, okay, this was a session. This was a couple sessions. This was a few sessions. I haven't had it in like a few months, but there's little spots I can see, little dents. People are gonna be like, what are you talking about? Like, these little dents, but I just have to like get one of the girls to draw my blood and help me out and all that. I really, really like it. It does get better. There's nothing that's really bothering me. And I was talking to someone like, dang, I don't even think I'm gonna go back to filler. That's so bad. I'm like, I love filler, but I'm like, there's nothing bothering me, because that's been holding me down, holding me over for the past 2 years. Okay, guys, I'm going to go so I can watch the last few minutes. They did 3 PRF treatments, but didn't help much. Do you recommend Area Essence? So did you do the regular PRF, or did you heat it? If they heat it and make a gel out of it, you're going to see better results. And remember, it can take up to 6 months to see full effect. When they heat it and cool it and make the gel, not just straight PRP when they draw it and spin it, we take the part that after we spin, we heat it and cool it. So that makes a gel. It gives a little bit more of an instant lift, but also it holds those growth factors in your skin longer than if you just inject it without. So I tried that. Yeah, regular PRF. I don't think it, like, those growth factors and stem cells exposure is like a few weeks. PRP is like a few days. The Easy Gel, like, when we heat it, the gel part is up to 3 months that you have exposure. And so I tell them, like, give it time. I remember I had a patient, she came in like 6 months ago, and she came for her second treatment. We sell it in a 2-pack, because I'm like, 1 is not it. She came, she's like, I don't see anything. Her second one, I was like, give it some time. Like, it's not done yet. I never said you're going to see it with 1. And then she came again, like, earlier this week, and it's been 6 months. I was like, hey, you back? Will you see it? She was like, oh, heck yeah, I can see it. She's like, I can definitely. I was like, when did you see it? She's like, about 4 months in. She was like, she's like, I feel so much more lifted. I'm like, I know, it just gets better. And she was mid-40s, Indian, like, yeah. But I've seen this from all the patients. I'm like, trust me, give it time. This is not overnight. Now, if you want overnight, then we can do filler. Okay. Okay. If you want to be medical aesthetics NP, I'm like, keep doing what you're doing. Work in a med spa, shadow the provider, the injector, like learn all the things. Okay, I'm not trying to jump, guys. I just want to see him for like a couple minutes. Let me know if you have questions. Call or text the team. You can send DMs. You can send us pictures, and I can give you feedback. And then we can obviously jump on a real consult, so I can like thoroughly ask you a lot of questions and talk it through with you. Yeah, we're in LA. We're in Vegas. I'm going to be in Vegas on this Friday. So if you're in Vegas and want to be seen, it is the holiday time. So it's like the time where everybody's getting themselves all freshened up. But yeah, I appreciate you. I hope you have a great night. And I'll post these. I post them on my other like channels, the full thing if you want to watch it. Okay, talk to you soon. God bless.